I'm Dr. Matt Roeder with another Chiropractic Care Center video here to help you out with something that has a lot of misinformation about it, and we're talking about disc herniations. Now, disc herniations are referred to with many different terms. One of them is obviously disc herniation. Then you have something called disc derangement. You may have heard the term disc bulge, slipped disc. There are a lot of things, a lot of terms that we use to describe this. I personally prefer the term disc herniation or disc bulge because that, in my opinion, more accurately describes what happens to the disc. Now, let's talk about this in terms of chiropractic care. First of all, let's talk about how it happens. In between each one of the vertebrae, you have a disc. And inside that disc, you have some soft, jelly-like stuff called the nucleus. And over time, with bending, lifting, and twisting at the waist, what will occur is that disc will tear from the inside out. And when it tears, that soft jelly-like stuff, the nucleus, pushes out through that tear, and then you have the disc herniation. Now, when the disc herniates out, you'll notice this little yellow portion here. What we're looking at is a straight down view into the spinal canal where the nerves hang out, where your spinal cord is, and where the nerves exit out of the spine on both sides. Now, notice how this bulge is pushing out and it's pressing here. Now, depending on where that bulge presses, that's where you start to have pain. And when I talk about pain, typically what we're talking about is something we call radicular pain or radiating pain that goes down the arms or down the legs depending on where the disc herniation is. And since this is a lumbar model, we'll talk about lumbar disc herniations. When a lumbar disc herniation happens, typically it happens at the lower two lumbar vertebrae, L4 and L5. And when that herniation takes place and it presses on the nerve at L5, depending on where it's pressing, if it's pressing on the right side, then typically you will have pain going down the right leg. If it's pressing on the left side at L4 and L5, then you will have pain going down the left leg. And typically if it's pressing on both L4 and L5 nerve roots, these nerves coming out of the lumbar spine, then you will have pain all the way down your leg, your low back, your buttocks, your hamstrings, all the way down into your calves and feet, burning, radiating pain, numbness, and tingling. Now, there are other places that disc herniations can take place. We're simply specifically talking about lumbar disc herniations. So, we've talked about how disc herniations happen with repetitive bending, lifting, and twisting at the waist. Most commonly, that's how they happen. Now let's talk about what we do about it. Disc herniations are treated by chiropractors, by this office quite successfully, quite frequently. Now, we're not making any massive promises. I'm not telling you that there are miracle cures. I'm telling you that chiropractic can and does, on a regular basis, help disc herniations. Now, let's talk about how we do that. Typically accompanying disc herniations, you will usually have vertebrae that are what we call subluxated or stuck in the wrong position. And when you have vertebrae that are stuck in the wrong position, they are not moving and they're pressing on the nerves, you have a component of not only pressure on the nerve from the vertebra being in the wrong position, but pressure on the nerve from the disc being bulging out. And when that occurs, you see this little area right there. Well, that little area, you have a nerve coming out, and then you have the disc pushing on the nerve as well. And if you have the vertebra in the wrong position and the disc bulging out and pressing on the nerve, then you have multiple places where that nerve can be compressed and cause severe pain and numbness and tingling and burning, radiating pain into the areas where that nerve supplies. What chiropractic does, and what we do at this office, is work to relieve that pressure on the nerve by putting the vertebra in the proper position. And we also have a lot of therapies that we tell you to do not only at home, but work with you here to try to get the swelling and inflammation down in that disc area. And if we can do that, and if we can keep that happening on a regular basis, we're not talking about, we hit it once and then we walk away and we hope everything goes all right. Because I'm here to tell you, with a disc herniation, it's not a miracle process. It's a constant working at it over time, trying to get things under control. But if we can do that consistently, if we can keep that up consistently long enough, then eventually we get the pressure off of that nerve. The disc herniation, disc bulge begins to shrink. It gets smaller. And if it gets small enough, then the pressure is off the nerve enough that the body can begin to recover and heal up. And when we say recover and heal up, what we're talking about is we're talking about scarring this area over that's torn inside the disc and sealing it up so that that disc will quit punching out through that little area there and take the pressure off the nerve on a consistent basis. If that happens, if we are able to do that on a consistent basis, then pain levels begin to drop, swelling begins to go down, and then you start to feel better on a regular basis. Now, here is a little bit more information on this. When we say feel better, we are not saying completely better. We're saying we've gotten this thing to leave you alone a little bit. Now, once it's leaving you alone a little bit, you have a better chance more consistently of healing up and scarring that area over. Typically, disc herniations take somewhere around 14 weeks in order to recover from that. But it can be done, and it does happen. And if you take care of yourself properly and follow those home therapy suggestions that we will be giving you, then I truly believe that you can and will get better. Hey, I'm Dr. Roeder with the Chiropractic Care Center, and if you would like to talk about your disc herniations or have some questions about them or need some help with them or feel like you do have disc herniations, our phone number is 806-793-9005. We're in Lubbock, Texas, on 2321A 50th Street, and look for us with a big $37 sign on the window. We will be happy to help you and see if we can start getting you better.